Hey everyone, welcome back to Healthcast by Reem Hospital. Today we're diving into something that sounds simple, but is actually incredibly important for your everyday health. Vitamin B12. So let's start with the basics. What is vitamin B12?
Vitamin B12, also known as cobalamin, is a water-soluble vitamin that your body absolutely needs but can't produce on its own. So you have to get it from your diet. And it plays some really critical roles in your body.
Like what?
Well, first, it helps in making DNA and healthy red blood cells. It also supports your nervous system and brain function. And interestingly, it helps your body convert food, especially fats and proteins, into usable energy. Did you know that vitamin B12 is one of the few nutrients your body can store for years? It's like having a secret energy reserve in your liver, just waiting to be tapped into.
That's fascinating. It's like the multitasker of the vitamin world.
Exactly. But here's the catch. Even though your body can store it, getting enough B12 in the first place isn't always straightforward. It's not something your body makes on its own, so you have to rely entirely on your diet or supplements. And that's where things can get tricky.
Okay, that makes sense. But here's something I've heard. Just eating B12-rich foods isn't always enough, right?
Right? But here's the thing. Even if you're eating enough B12 rich foods, your body has to absorb it properly to actually benefit from it. And the absorption process is surprisingly complex. It starts in the stomach, where stomach acid and enzymes release B12 from the proteins in food. Then, it binds to something called intrinsic factor, a special protein made in the stomach, which is essential for its absorption in the small intestine.
What if someone has lower levels of stomach acid or enzymes?
If someone has low stomach acid, or if they had gastric surgery, that process can get disrupted. And there are other factors too, like certain medications or digestive conditions that can interfere with absorption.
So even if someone is eating a diet rich in B12, they might still end up deficient if their body can't absorb it properly.
That's why some people need B12 injections or sublingual supplements to bypass the digestive system altogether.
Let's talk about the benefits of vitamin B12 because there are so many.
First and foremost, it's crucial for red blood cell production, which helps prevent anemia. Without enough B12, your body can't produce healthy red blood cells, and that can lead to fatigue, weakness, and even shortness of breath, and it's especially important during pregnancy. Adequate B12 levels can reduce the risk of birth defects and support healthy development for both the mother and the baby.
Is it also linked to bone health?
Studies have shown that low B12 levels can lead to reduced bone density, which increases the risk of fractures, especially in older adults. And then there's its role in cognitive health. Maintaining optimal B12 levels can help slow age-related memory decline and support overall brain function.
So we can say it's like a protective shield for your brain as you age, right?
Right? And speaking of the brain, B12 is also essential for the nervous system. It helps maintain the health of nerve cells and supports neurotransmitter production. Without it, you could experience symptoms like numbness, tingling, or even poor coordination.
Speaking of symptoms, how do people know if they're low on B12?
Those symptoms actually tie into B12 deficiency, which can be tricky to diagnose because it develops slowly. Unlike other vitamins that need to be replenished daily, B12 is stored in the liver in significant amounts. Most healthy adults have enough reserves to last 2 to 5 years.
But that also means symptoms might not show up until your levels have been low for a long time, right?
Yes, early signs of deficiency can include fatigue, weakness, pale skin, and shortness of breath. But as it progresses, you might notice numbness, tingling, memory lapses, or even mood changes like depression or brain fog. And here's the scary part. Some symptoms, like nerve damage, can occur even before anemia develops. That's why early detection and treatment are so important. So early detection is key.
Let's talk about the best food sources for B12.
Seafood and meat are at the top of the list. Clams, liver, oysters, salmon, tuna, beef, and turkey are all excellent options. And for vegetarians or vegans, fortified foods like cereals, soy milk, and nutritional yeast can help. But let's be honest, it can be challenging to get enough B12 from plant-based sources alone, which is why supplements are often recommended.
That's a good point. How do you know if your levels are normal?
The normal range for B12 levels in the blood is typically 160 to 950 picograms per milliliter, though some labs use a range of 200 to 900. If your levels fall between 150 and 399, it might be worth checking your methylmalonic acid levels. High MMA levels usually indicate that your body isn't getting enough active B12, even if your blood test looks borderline.
So what should you do if you're deficient?
First, try to boost your intake of B12-rich foods or fortified options. If that's not enough, supplements or even medical treatments like B12 injections might be necessary. Regular checkups are also key, especially if you have risk factors like age, digestive conditions, or a vegan diet. It's always better to catch a deficiency early before it leads to more serious issues.
I've heard of cyanocobalamin. What is that?
It is the most common form of B12 found in supplements and injections. It's generally safe when taken as recommended, but like anything, it can have side effects. Some people might experience headaches, dizziness, or mild diarrhea. Injection site redness or swelling can also occur, and in very rare cases, allergic reactions like rash or difficulty breathing. And then there are potential drug interactions. For example, metformin, a common medication for type 2 diabetes, can reduce B12 absorption over time. Proton pump inhibitors and certain antibiotics can have similar effects. That's why it's so important to tell your healthcare provider about all the medications and supplements you're taking, and they can help adjust your treatment plan if needed.
Before we wrap up, let's talk about how B12 works alongside other nutrients, like vitamin D and folate.
Together, they offer a range of benefits, from energy and mood support to immune system strength and healthy aging. B12 and vitamin D, for instance, both play roles in reducing fatigue and supporting emotional balance. B12 helps produce white blood cells, while vitamin D activates immune cells and controls inflammation. And when it comes to folate, the two are like a dynamic duo. They're both essential for red blood cell formation and nervous system support. But here's an interesting fact. High folate intake can mask a B12 deficiency, while nerve damage continues to develop.
So it's crucial to check both levels together, right?
That's such an important point. And for anyone on metformin, make sure to monitor your B12 levels regularly. Long-term use of the medication can interfere with B12 absorption, so supplementation might be necessary.
Quick practical tip. When should people take B12?
B12 is best taken in the morning on empty stomach or early afternoon because it boosts energy. Taking it late in the evening might interfere with sleep for some people. All right, let's sum this up. Vitamin B12 is essential for so many aspects of health: energy, brain function, red blood cell production, and more. It's stored in the liver, so deficiencies develop slowly, but early detection is key to preventing serious complications. And whether you're getting your B12 from food, supplements, or medical treatments, the goal is to maintain optimal levels. It's not just about avoiding fatigue, it's about supporting your overall health and well-being at every stage of life.
And with that, we've covered everything you need to know about vitamin B12. Hopefully this helps demystify the topic a bit. A big thank you to our listeners for tuning in. Stay tuned for our next episode, where we'll continue bringing you practical, easy-to-understand health topics. Until then, take care and stay healthy.